Studies have shown that women with dense breast tissue are more likely to get cancer, and on top of that, it's also harder to see it on a regular mammogram. So doctors started performing an MRI to see through the dense tissue. When breast MRIs proved to be successful, the natural next step was to figure out how to reduce the cost and make it an option as routine screening. Most women know to get regular mammograms based on age and family history. But the more dense breast tissue that a woman has, which increases up to a certain point as she ages, the less accurate the mammogram. A 7-year study at Regional Medical Imaging in Flint has found that for women with breasts of 50% density or more, which ended up being half of the women in the study, the MRI was more accurate.
The research was highly suggestive that up until the woman decreases the amount of dense tissue, the main study should be breast MRI and then switch over to mammograms later.
So even if their mammogram came back negative for cancer, women with dense breasts may want to get an MRI. But this led to a new issue.
The problem has been expense. So when we started this research, we wanted to take a look at how many cancers were being missed by mammography, if there were any, and at the same time, could we figure out which one of the sequences that we were using with the MRI machine could find these cancers on a regular basis and cut the costs down by reducing the length of the study.
Normally it would take about half an hour to get a full MRI breast study. Now,
7 minutes maximum. That allows us to put more people through the scanner in any given hour, and we're able to drop the cost by 70%.
It's generally around $1,000 to get an MRI done. Now the cost is $395.
And what's really interesting is because the study is so precise, in general, the majority of the women, they only need to come back every other year for the study, which again cuts the cost in half again. So a little under $200 a year, you're well within the same range or even a little bit less than screening mammography.
The MRI is aimed at females who simply have dense breast tissue and may have a mass that a mammogram can't see, like Adrienne Allen, who was diagnosed last year.
I had regular mammograms every year since I was 40, and my last mammogram came back negative like all the others had. This year the letter was different though. It did state that I had very high breast density, 75% or higher.
After discussing it with her OB/GYN, Adrienne decided to get an MRI to put her mind at ease, even though her insurance company wouldn't cover the first screening. Her husband said it would be worth it, and he was right.
I was very shocked to learn that I had a very small tumor, but it was definitely invasive ductal carcinoma. But found it at a very small measurement, only 5 millimeters, very tiny.
She met with a breast surgeon who said,
"You're a lucky girl," and I was really quite shocked. We were taken back by that, thinking, well, I don't consider myself lucky, and she said, you should be very lucky. We found this so early, and it's at a very treatable stage, and you will definitely not be dying from this breast cancer.
MRI results can actually show cancer in the breast up to 6 years sooner versus mammography, spotting virtually all suspicious areas, and it doesn't use radiation, and it's now made Adrienne a cancer survivor.
From regular mammograms, digital mammograms, 3D mammography, ultrasounds, this is truly the gold standard in trying to find breast cancer. Breast MRI has been going on for about 8 or 9 years, but the idea that we could reduce the cost significantly, focus in on just the steps that find these cancers in women that we screen, that idea is brand new.
Reminder, everyone is different, so a patient should consult their primary care physician regarding what tests to take. This research showed that not only the patient could save money, in 10 categories of expenses to the insurance companies, using an MRI resulted in an over 2,000% in savings. The hope is that in seeing this statistic, the screening will be a covered test by insurance companies in the coming year or two. Christina Burkhart, ABC 12 News.